And now it's time for a new year, which means growing and focusing on building yourself. But sometimes our feelings and our mental health can get in the way of that, especially during the cold and dark time of the year like winter. It's possible the season is the reason if you're feeling down. Rachel Robinson has more on seasonal depression and what you should do if you think you might be experiencing it.
Christina, it's important to look after yourself not only in the winter season, but during and after the holidays. And there are things to watch out for when it comes to seasonal depression.
The cold weather, the dark nights can make you feel a little bit off.
The transition into the fall and the winter is very difficult. It involves a lot of symptoms of depression, feeling tired, sleeping more, having low energy, and the symptoms in a kind of domino effect can develop into a full-blown clinical depression.
And those symptoms are something to keep an eye on.
They include feeling sad, feeling really down, losing interest in things that the person would usually enjoy, like their hobbies, their social activities, extreme fatigue, difficulty concentrating, making decisions, eating a lot more or a lot less than usual, sleeping a lot more or a lot less than usual, feeling guilty or worthless about oneself, and in extreme cases, thoughts of death or suicide.
If you have a few or all of these, it's important to seek help.
When the symptoms are getting in the way of your ability to function in important roles, like at work or at school or in relationships, or they're keeping you from doing things that are really important to you to live a valued kind of life that you would want to live.
And there are tools out there to help.
They include antidepressant medications, the same ones that are effective for depression. Another treatment is bright light therapy, and that's a very effective treatment with clinical trials around the world supporting it as a really robust improver of sad symptoms. And the third treatment is a kind of talk therapy that's called cognitive behavioral therapy.
And if you have any type of those feelings, let your health provider know.
Most people with seasonal depression suffer for many years before they tend to come forward for treatment. So I would say if you feel like you struggle with symptoms of depression in the fall and the winter, there's no reason to suffer.
These types of depression can feel stronger in the winter and even around the holidays. Some simple tricks to feel better are getting some exercise, like going on a walk, talking to a close friend on the phone or in person. Also, it's important to reach out to your doctor if you feel this way, not only in the winter months, but all the time. Christina, back to you.